52 days since the country confirmed its first case of Covid-19, and it recorded its highest number of new infections as 30 more people tested positive out of 883 samples tested. The spike bringing the total positive cases to 465. Out of the 30, 19 originated from Mombasa, 8 from Nairobi and 2 from Bungoma, the 2 being truck drivers whose cases were confirmed in the ongoing targeted testing. The government today taking issue with Kenyans who are downplaying the risk the virus poses and returning to old ways in the face of regulations to curb the spread of the virus.
We have noted with dismay the casual attitude with which some of our people are not observing these measures.
They are celebrating too early, and that it is their behavior, their precise behavior, that will lead us to doomsday.
What worries the government more is that the disease is rapidly spreading in communities. Already 15 counties have recorded cases. Once again, a fervent plea to Kenyans who are flirting with death to adhere to directives put in place to stop the spread. Religious leaders, restaurants and eateries and those in public service transport who are disregarding government orders were put on notice that they would be firmly dealt with.
Some mosques have revised prayer time and are now opening for prayers at night. This contravenes the directive that suspended all religious gatherings.
With mass testing in hotspots mapped out across the country ongoing, the government is alarmed over the low turnout. For instance, in Kawangware, which has recorded 22 cases, the government was targeting to test 2,000 people. 2 days later, only 803 had heeded the call. Eastleigh with 26 cases, but only 494 people have been tested out of a target of 3,000.
When you identify people who are positive, you can remove them from the general population, put them in isolation. Many of these people that we have been, who have turned out positive, actually have very mild disease, if any, or are asymptomatic.
And with statistics showing that fewer Kenyans who are visiting hospitals for treatment of other ailments due to fear that they would contract the virus from the facilities or health workers, the ministry gave the assurance that measures had been put in place to protect them. 15 recoveries were recorded in the last 24 hours, with 2 COVID-related deaths in Mombasa, taking the total number of fatalities to 24. With widespread community transmission having been established, this is definitely calling for a change of strategy, especially in the densely populated areas, which are increasingly recording higher numbers as the days go by. Chemutai Goin, Citizen TV, Nairobi.